family interventions for high mortality health conditions. A strategic review from 2010 to 2019 is a must-read for 2022 and a resource for family therapists and healthcare professionals for years to come. In 2019, a group of 13 medical family therapy research experts came together with the task of identifying and evaluating the empirical evidence of couple and family interventions in relation to health. As medical family therapists who are also systemic family therapists, we see health, wellness, illness, trauma, and death in the context of families as they interface with larger systems such as healthcare, schools, and military systems. As medical family therapists, we hold many roles, often simultaneously, including that of provider, educator, supervisor, scholar, policymaker, and administrator. In our roles as scientist practitioners, we must think about the ways in which our practice is informed by science and the ways in which our science is informed by our practice. But health, as you can imagine, encompasses so many conditions. Therefore, as a team, we contemplated many places to begin with our research for this article. We decided upon the conditions with the highest mortality in the United States. This publication captures an evaluation of efficacy for couples and family intervention with the focus on the most prevalent health conditions that lead to mortality in the United States. These health conditions include accidents, chromosomal abnormalities with infants, accidents and cancer among children aged 4 to 14, accidents among adolescents aged 15 to 25, as well as heart disease, cancer, accidents, chronic lower respiratory diseases, stroke, Alzheimer's disease, diabetes, influenza and pneumonia, nephritis, and nephrosis among adults. We also included obesity across the lifespan as a leading preventable indicator in high mortality conditions. Our aim was to provide a review of the empirical support for couple and family interventions in context of specific health conditions in order to better prepare family therapists to provide best practices to couples and families across the lifespan, regardless of the therapist's work context, such as private practice or primary care. Our team reviewed 20,111 articles with a final sample size of 87 articles that fit our inclusion and exclusion criteria. Each article was evaluated by Southern Garreau and Princeton's level of efficacy and an incredibly important contribution to family evaluation through Pratt & Sonney's level of family inclusion. Our hope is that this manuscript can be a resource whereby readers can dive in deep to the very specific tables contributed for each high mortality diagnosis, particularly for family therapists who treat families who are experiencing health concerns such as obesity, cancer, heart disease, diabetes, or stroke. While the manuscript offers a high-level view of the intricacy of high mortality health conditions, there is also in-depth detail offered through numerous tables that highlight the work we have accomplished on behalf of couples and families and the work that we have yet before us. We are grateful for your readership for our article, Couple and Family Interventions for High Mortality Health Conditions, a Strategic Review, 2010 through 2019.